Good morning, everyone. I'm Dr. Jim Allen, and I'll be moderating today's COVID health and wellness briefing. The purpose of these briefings is to give members of the media direct access to some of the medical center's leaders and COVID-19 experts at The Ohio State University in order to help support and enhance statewide communication efforts with science and medical information. Let me introduce today's panel. Dr. Andrew Thomas is the Chief Clinical Officer of the OSU Wexner Medical Center and the Regional Representative on Pandemic Response. Dr. Tom Ryan is the Executive Director of the Richard M. Ross Heart Hospital and the Director of the Heart and Vascular Center. And Dr. Saurabh Rajpal is a cardiologist who has studied heart damage in COVID-positive patients. Well, Dr. Thomas, let me start off with you. We've seen the number of COVID patients decline recently while more Ohioans are getting vaccinated. Can you give us an update on how things are going for the OSU Wexner Medical Center and for the region?
Good morning, Jim. Thanks again to all the media for being here today. I'd be happy to give an update. I think unlike many of the updates we were giving through the fall and into December when we were looking at some worst case scenarios, things are actually looking quite good in terms of hospitalizations. Back in mid-December, the state peaked at over 5,000 inpatients with active COVID disease. And as of today, it's down closer to 1,500 from 5,000. Here in Zone 2, which is Central Ohio, Southern and Southeastern Ohio, we peaked at over 1,200 cases back just 2 months ago in mid-December, and we're down to just over 300 cases of active COVID in the hospital today. So in general, I think it's a good news story. I think it's a combination of people that are at high risk being vaccinated. I think we've also made it through the holidays where people are hopefully having a little less contact outside their bubble. And also really, once again, even before the December holidays, we had started to see a decline in hospitalizations. And as we've said before, if you educate the people of the state of Ohio on what they need to do and encourage them, they will respond. And I think we've clearly seen that as our case numbers have come down.
How are you doing with vaccinations here at Ohio State?
Well, the vaccination program's really done a terrific work. Obviously, we started in December with our own faculty and staff. In mid-January, we moved over to the Schottenstein Center. I think a number of the members of the media have been over to that site. We're actually quite proud to say that today we'll actually cross having delivered vaccines delivered in the Schottenstein Concourse are actually twice the seating capacity of the Value City Arena. When you think about what that arena looks like when it's full and hopping with a big crowd, to think that we vaccinated twice as many people in the concourse as the seating capacity of the arena, it's really amazing. If you look back from the beginning of the vaccine program, we today will actually reach 50,000 total vaccines administered, total doses administered, combination of first and second doses, but we'll reach 50,000 total doses delivered later today as well.
Is there any concern that we could be seeing more cases now that the statewide curfew is being lifted and Ohio schools prepare to get students back in the classroom 5 days a week?
As I mentioned, I think our case numbers have come down similar to the hospitalization numbers, which is great news. As more people are vaccinated that are high risk, that should reduce the impact of hospitalization, but certainly case numbers in and of themselves are at risk of going back up if people stop paying attention to those key things they need to do with wearing a mask, keeping your social distance, washing your hands, and then if you run a business, washing high-touch surfaces and keeping things clean, and certainly still avoiding mass events where there's not the ability to control your environment. I think that at this point, the curfew hopefully served its purpose back in November, and we should not see a bump up in cases related to that if people are following what they're supposed to be doing in those after hours times. So in terms of going back to school, we found, and actually the Ohio State University College of Public Health did a study on behalf of the state that found really low percentages of transmission in Ohio schools if, and I should say in the classroom, for classroom exposures, if both parties were wearing a mask. So that's really one of the keys in our school systems, but we found very low transmission, and I think that's a big reason why the state has been really encouraging schools to get back into at least hybrid, if not full in-person sessions. So I'm hopeful if people follow the rules and mask, distance, wash their hands, don't go to work sick, don't go to school when you're sick, we really will not see a huge ramp up in cases. As we talked about variants before on this on these press conferences, I do think that's probably the one wild card that we don't know yet, the impact of that. And we'll obviously be learning more and more about that over the next few weeks and months.
Well, Dr. Ryan, as we recognize February as National Heart Month, we thought it would be fitting to share the latest about COVID-19 in the heart. My first question, what is COVID-19 doing to the heart?
Thank you, Jim. Well, as many people know, many viruses can affect the heart muscle, primarily through causing inflammation. This is mostly temporary, but it occasionally can be permanent and lead to serious heart issues like heart failure and heart rhythm problems. COVID seems to have a particular predilection for affecting the heart, and it does so in two different ways. It can directly affect the heart by causing direct damage to the heart cells. Viruses can enter cells in the body and cause those cells to die, so it can lead to heart damage through that mechanism, and also indirectly through inflammation. COVID seems to be very good at causing general inflammation throughout the body, and that inflammation can in turn cause things like heart attacks, can cause strokes, can cause increased risk of blood clot formation, and these kind of things. So these are the reasons why we're so concerned about COVID in the heart and some of the mechanisms by which it causes those problems.
Is it just the more serious hospitalized cases of COVID that experience heart damage?
Well, again, most patients who contract COVID will recover uneventfully, and most of those patients probably do not have clinically significant heart involvement. But we honestly don't know whether there's a small percentage of people out there who will get some degree of heart muscle involvement, heart muscle inflammation. Dr. Rajpal will probably talk a little bit more about that based on his research in athletes. We do know that there are certain groups that are more at risk for developing heart complications. Those include patients that are older, particularly patients over 65 years of age, patients that have a history of high blood pressure, coronary artery disease, previous stroke, lung disease, smoking. These are all what we call risk factors that increase the chance that a relatively mild and self-limited virus infection can actually become much more serious and lead to hospitalization.
Well, Dr. Rajpal, tell us a little bit about your research looking at myocarditis in athletes with COVID and why it's important.
Morning, Jim. So we were asked early on during the pandemic to clear athletes for athletic competitive participation while they were recovering from COVID. We had various meetings with our athletics departments and our sports medicine physicians. We decided that in addition to a clinical exam, echocardiogram, and electrocardiogram, we would do a cardiac MRI to make sure that the athletes did not have heart inflammation from COVID. Now, like Dr. Ryan said, most of these heart inflammation is minor and people recover. However, athletes are a special population because they perform strenuous activity, which could lead to worsening of inflammation in the heart and can lead to things like heart failure and heart rhythm problems. Therefore, before clearing them for competitive play, we decided to do a cardiac MRI and found that of the 26 people we had reported, athletes we had reported in our previous study, 4 of them had evidence of heart inflammation. I'm happy to report that all of them recovered and were able to go back after a period of rest into competitive sports participation.
Why is myocarditis a concern, even among otherwise healthy people, and how do you treat it?
Well, fortunately, myocarditis is rare. It is extremely rare to have in autopsy studies, only about 3 to 4% myocarditis has been seen. It is very easy to treat. The treatment is rest. You rest for a few weeks. Usually 3 months of rest is required, and myocarditis heals up.
Well, Dr. Ryan, we've heard about the significant decrease in heart-related emergencies across the nation during the pandemic. What was going on? Were there really, truly fewer cases? And have emergent cases increased now, or is there any concern that some people may have avoided or delayed care?
Good question, Jim. There's no medical reason to believe that the prevalence of heart disease decreased during the pandemic. So what we think happened is that patients, understandably, were reluctant to go anywhere, including the hospital or their doctor's office, to seek care that they might otherwise have sought had it not been for the pandemic. So a lot of our patients, unfortunately, did not come in to get the care they needed for those many months. And as a result of that, as the pandemic progressed, we started to see more patients coming in with more advanced forms of heart and blood vessel vascular type diseases. So I think the lesson here is to remind everybody that it is absolutely safe to come into the hospital. In fact, I would argue that hospitals are one of the safest places to go during a pandemic because of all the precautions that we routinely take. And seeking care when symptoms develop is always appropriate. You don't want to trade avoiding the COVID infection with a more potentially serious heart rhythm issue or heart condition of any kind. So that's what we think was happening.
Is there anything that someone can do to prevent or reduce COVID-related heart damage?
Well, the first, of course, obvious answer to that is avoid getting COVID in the first place. The things that Dr. Thomas talked about in terms of prevention, and certainly now is not a time to let your guard down. Continue to do all the recommendations that I think we're all familiar with at this point. We do know that there are some treatments we can institute early on in at-risk patients, patients that are elderly or patients that have a history of heart disease, that probably reduces their chances of getting the more serious complications that we've talked about. So seeking medical attention when you're at risk or when you have significant symptoms from COVID is absolutely appropriate. And there are some things that can be done to reduce the chance of a more severe complication.
Dr. Rajpal, for someone who's recovered from COVID-19, how and when should they return to exercise? We're used to hearing about professional athletes and college athletes who are off on protocol, the COVID protocol after they're infected. What about for the average person returning to exercise?
Yeah, after any viral infection, the body takes some time to recover. So for the first few days or a week, it's okay to take it easy and gradually get back into exercise. What we have usually been recommending is for the first couple of weeks, perform about 50 to 60% of your maximal usual activity, and then gradually get back into your full activity. And while you get back into full activity, and if you notice any symptoms of chest pain, shortness of breath, palpitations, see your primary care doctor for those.
Well, Dr. Ryan, should people who have had COVID consider seeing a cardiologist, or how might they know if they have COVID-related heart damage?
Well, again, most patients who recover from COVID probably do not have clinically significant heart problems. I would say a couple categories that should consider a heart evaluation. First of all, people who have pre-existing heart disease should probably check in with their cardiologist after recovering and be evaluated. I think anyone who was hospitalized and really had a serious bout of COVID, ended up, for example, in the intensive care unit for a period of time, those are the patients that are probably at greatest risk. And then finally, anyone who had heart-related symptoms during their infection period, including things like irregular heartbeats, fainting spells, chest discomfort, severe shortness of breath, those are all symptoms that could indicate a heart problem. And I think for those patients, seeking medical care is appropriate. I think one approach would be to contact your primary care physician and have a conversation with him or her about whether subspecialty care with a cardiologist or other specialist is required.
Let's go to Brittany Bailey from 10 TV.
Good morning, everyone. I wanted to know if you had any general figures about the percentage of people who might experience these longer term effects who contract COVID, and if there was a concern that people don't understand and don't realize some of these potentially very long-term impacts, and they're not taking COVID-19 seriously still. And there's a lot we still don't know about the long-term impacts, I'm sure. So kind of a two-pronged question, if you know about the percentage of folks who might experience these, and if you're concerned that people are not taking this disease or this virus seriously still, even knowing these long-term potential impacts.
Dr. Rajpal, in your study, what was the percentages that you were identifying?
Yeah, in the, I would say the numbers that we have point towards a 5 to 7% of just minor heart inflammation. And in almost all these cases, there has been complete recovery after a few weeks of rest.
Of course, just remember, these are young, healthy athletes. And they're a very different population from a 70-year-old patient with a history of coronary artery disease. And as we get older and as we have more risk factors, then the chances are certainly going to be higher.
Jim, one thing maybe I could add to Brittany's question, I think as our cardiology colleagues have described, you know, the more likely, if you're in the hospital or more seriously ill, the more likely you'll develop myocarditis. I think that goes for many of the side effects and complications with COVID. But I'm a primary care physician. I talked to a number of my patients and just even other friends and colleagues who've had COVID. And I think there are a variety of symptoms that even folks that have minor illness have been describing in terms of everything from brain fog, word finding issues. It does seem to resolve over the course of days to weeks after you have the infection. But obviously, if you're sick enough to be in the hospital, some percentage of those folks with critical illness and on the ventilator develop probably more chronic issues with lung disease. They may end up on dialysis, other things that just go along with being really sick and what we call septic with a whole body infection in the hospital. So I think, Brittany, your question's a good one. I do think, you know, the more likely to get, you're more likely to get those sort of long-term side effects the sicker you get with coronavirus. But it's really a number of folks who don't end up in the hospital still are getting some of these long-term side effects that we hope will resolve in, you know, weeks to months after their illness is done. But it is certainly a serious concern.
Dr. Ryan, is myocarditis something unique to coronavirus, or can other viruses cause myocarditis?
No, many viruses can cause myocarditis, and we see it. We've seen it for forever. COVID seems to cause it more frequently than most other viruses, and certainly seems to cause them, has the potential at least to cause a more severe form of it. And again, that's one of the main reasons it's caused such a terrible problem throughout the world in this last 13 months.
Dr. Rajpal, you did cardiac MRIs on your athlete population that you studied. Does everybody who have COVID need to have cardiac MRI in order to return to exercise?
No. Competitive athletes are a very special and unique population. They perform at very high and intense level of activity. So for them to return back, MRI is an appropriate screening test. But for the general population, that's not the right or the best test to do. And as it is fortunately a very rare condition, myocarditis.
Let's go back to Brittany Bailey from 10 TV.
Yes, thank you for indulging another question. And I did hop on a couple of minutes late, so I apologize if this was addressed. But now that we're seeing some of these new variants developed, is there any reason to believe that some of these effects that you're describing could be worse with these variants?
It's a great question in terms of the impact of variants. I think at this point, most of the focus from what I've read and certainly talked to our infectious disease and our research specialists here at Ohio State and around the state, the biggest concern with the variants is around how easy it is to contract the virus. In other words, how contagious the virus is. And the way I describe that to people is if, first of all, I have to be coming into contact with someone and it's still in a close way to get the virus with a variant. It's not like it's more transmissible in terms of it's transmitted a different way. It's transmitted the same way as the traditional coronavirus is transmitted, which are typically respiratory droplets which come out of someone's mouth or nose. However, if I come into contact with those droplets, it takes fewer droplets to get me infected if I'm coming into variant droplets as opposed to the more traditional coronavirus. But it's not like it's now 20 feet instead of 6 feet, or it's now 30 seconds instead of 15 minutes. The basic parameters we think are still the same in terms of how you keep yourself safe. It's masking, it's distancing, it's washing your hands, all those things we've been talking about. So contagious is probably the main difference. However, there is some evidence out of England that may also cause a more substantial form of sickness. The virus might actually make you sicker or be more virulent, we call it. But I think that evidence is still not exactly clear. Certainly it doesn't seem at this point of what we know in the United States that that's the case from what I've read, but I think it's still a minority of cases in the United States that are being caused by these variants. So I think we still have a lot more to learn about them. The other good news is that most of the variants still seem to respond to the vaccine, and even those that have a slightly lower response generally respond. It's just a slightly less effective response. But once again, I think we need more evidence and more studies to be done to really show the impact of these variants on vaccine effectiveness. At this point, we think the Pfizer and the Moderna vaccines are effective and are certainly recommending that if individuals are invited to be vaccinated, that they sign up and get the vaccine, whichever one they're offered, as soon as they can.
Dr. Ryan, thousands of people in Central Ohio have been affected by COVID. Are there certain warning signs or symptoms that the average person should be on the lookout for that would cause them to seek additional medical attention for possible heart problems?
Yes, Jim. I would say that any symptoms that are typical of an acute heart condition, things like chest discomfort, severe shortness of breath, irregular heartbeats, palpitations, fainting, those kind of things that would indicate heart involvement would definitely be a reason to seek medical attention. And then, of course, most of the patients that we've seen come into the hospital do so because of progressively severe shortness of breath. And that's the most typical symptom that eventually leads people in to seek medical attention and is often a reason why people then get admitted to the hospital.
Are there any other heart-related concerns that you're seeing a lot of right now?
Well, you know, the other concern we've seen is an increase in heart attacks. That's probably related to the inflammatory effects of the virus that can affect what we call the plaque, the cholesterol buildup inside the arteries around the heart, and can destabilize that and lead to heart attacks. So that's certainly a concern. And as Dr. Rajpal said, serious heart rhythm problems have also been a big problem with COVID, and so that's an additional concern. And then finally, I believe among hospitalized patients, the risk of stroke as a complication of COVID is somewhere around 6%, so quite high. So these are all very serious concerns that, again, should get everybody's attention and should be a strong incentive to do everything possible to avoid contracting the virus in the first place.
Let me just take some parting thoughts from each of the three of our panelists about what you all would want people to know about COVID in their hearts or about the current status of COVID. Dr. Ryan, let me go to you first.
Well, I hope at this point everybody agrees that this is a very serious infection that has an inordinate impact on our entire world, certainly our country and our state and the city of Columbus. And I think we've also, if we've learned nothing over the last year, is that COVID can largely be prevented by doing the kind of well-known prevention strategies that Dr. Thomas referred to: washing your hands, wearing a mask, social distancing. And I just hope that as the weather gets better and the numbers go down, that we don't let our guard down and we continue to do all those things until we feel we're in a safer spot with COVID in the months to come.
And before we go to Dr. Rajpal for his parting thought, we have a question from Alan Henry from NBC4.
You can speak on the research being done into this, the long-term effects, because it is a novel coronavirus, and how much uncertainty there is with the long-term impact of it.
Dr. Rajpal, in your study, was there permanent damage to the athlete's heart, and what was the long-term prognosis?
Long-term prognosis in general has been good. Most of the cases of mild inflammation that we found on MRI have completely recovered. But again, like Dr. Ryan has mentioned, this is a very special population that we have studied. In our research, however, there are other research projects going on that are looking for long-term effects in other populations, such as those with underlying heart disease, diabetes, high blood pressure, obesity, and things like that.
You mentioned that the inflammation went down. Were these athletes' hearts functioning normally after they recovered in terms of their cardiac output and other measures of cardiac function?
Yes, the heart function recovered completely and normalized.
Good. Dr. Thomas, any parting thoughts that you'd like to leave our members of the media with?
Thanks, Jim. I guess, my parting thoughts would be just a thank you to the citizens of the state of Ohio. As we talked about back in November and into mid-December, we saw continuing increases in number of cases, number of hospitalizations, and it really could have gotten a lot worse, as we saw in other states coming through the December holidays. But we appear to have peaked in mid-December, and actually we're already seeing trends of decreasing cases and decreasing hospitalizations as we got into January, and certainly those trends have continued. So just a big thank you for the citizens of the state of Ohio who've really kept a focus on what they need to do, which is staying inside their bubble, wearing their mask, making sure they're social distancing when in public, and certainly washing their hands. So just a thank you to everyone in the state who's doing their best to try and prevent the spread of this virus. And then lastly, just when you have a chance to get vaccinated, please take that opportunity. It's safe, it's effective, side effects are quite low. Any side effects you do get just means that the vaccine is working and your body's making the antibodies that are gonna protect you and your family.
And Dr. Rajpal, a parting thought about COVID and the heart.
So in general, the COVID has led to this quarantine and us trying to stay in a bubble, but lack of physical activity is an important cause of heart disease. So, that should be avoided. We should still indulge in physical activity, moderate exercise 3 to 4 times a week at least. Try to take your diabetes medicines if you're a diabetic, blood pressure medications, because these are the populations that are at risk of heart involvement with COVID. And that should be the focus from a preventive point of view in heart health.
Well, let me thank today's panelists, Dr. Andrew Thomas, Dr. Thomas Ryan, and Dr. Saurabh Rajpal. And let me also thank each of you from the media for attending these updates. We hope you found them helpful and useful. Well, this is our last regularly scheduled COVID media briefing. As there are new developing news to share in the future, we'll be back. And until then, please stay healthy, wear a mask, and get vaccinated as soon as it's your turn.